Welcome to Medical Monday with Nurse Princess. We will be discussing medical issues, medical conditions, health things that could be done, prevention, treatments of certain things every Monday. And today is Monday, April 21st, 2025. So today's topic is going to be about hypertension, also known as high blood pressure. So I will be talking about um, um, what hypertension is, what the risk factors are, who's at risk for having high blood pressure, what are the symptoms of high blood pressure, how do we treat high blood pressure? What are the complications of high blood pressure? How do we prevent high blood pressure? So I will first start with what hypertension is, also known as high blood pressure. High blood pressure is when our blood vessels, like when you check your blood pressure is high. The reason why it's high is because the blood vessels dilate, they open up, and there is a lot of force that the blood is pumping, a lot pumping with force through the vessels. And when that is consistent or like starts when that happens regularly, it leads to hypertension. Some people that have hypertension or those sometimes you might not be diagnosed with high blood pressure or hypertension. Some people blood pressure might be up from stress, just sudden distress, or maybe something just happened to you. Your pressure goes up. Sometimes when we are afraid of certain things, or if we've received a very serious news, our blood pressure goes up. The body reacts quickly towards that. So we do have a range. We have a range for normal blood pressure, and when that range is, when you check your blood pressure and it's above, when it's above that or even below, but today we're talking about high blood pressure, hypertension. Maybe next week I will go for hypertension, low blood pressure, because some people have that um, range. Some people have that, but the normal range for hypertension is blood pressure less than 120 over 80. So we deal with the systolic and the diastolic. Systolic um, is when the heart starts to beat. Diastolic is when your heart rests. So when the heart starts to beat, it's pumping, loved up. I'm not going to go too much into details, but when it starts to beat, there is a limit it goes to. But when that limit passes 120, it goes up to 130. That is high. When the limit goes up to, when that top number, we are systolic, when the heart starts to beat, when that systolic goes up to 135, 140, 150, 160, that's something you should be concerned of, because the heart now is not resting. It is pumping a lot. Now the diastolic is when the heart rests. So that's the bottom number. So that number should be um the range for the regular blood pressure should be less than 120 over 80. So when that bottom number is so high, if it's over 100, if it's over 110, that means your heart is not resting. That is a problem. Because when your heart is not resting, your heart muscles start to pump a lot. And when you pump too much, the muscles give up. The muscles become weak. Some people muscles become enlarged because it's too much pumping, the muscle starts to stretch. So it's a concern when that happens. So for high blood pressure, what we call hypertension, we want it to be at um, a specific range at a certain level. People that have high blood pressure, we usually call um, it like the silence. Um, like that, some people might not feel symptoms. Some people might not, but some people. For me, I pay attention to it when I was pregnant. I There were certain things you have to know your body. So there were certain things that I knew were not right. I would start feeling this headache. My eye would start like pounding a lot. So you have to know yourself. Some people don't know. Some people may not feel symptoms. Some people don't even know they have it. That's how some people die from heart attack, stroke, and stuff like that, because they did not know um, what happened. We call it the silent killer. Because some people don't know, some people do not know the symptoms. They may be walking, and out of a sudden, you will hear that this person dropped dead. It is not because they were voodooed or witch or whatsoever. Sometimes it's like they did not know they had hypertension, and when the heart starts to pump a lot of blood and starts going at that rate, we have blood clots because there's no chance for the heart to really go through the normal process. So we start having blood clots, and then that causes another thing, stroke or blockage or whatsoever. So I'm going to talk about who are at risk for having hypertension or high blood pressure. Older folks, for people from Africa, West Africa, genetics, your genes. The statistics shows that from West Africa, the rates of having hypertension is high compared to this side of the world. Those that are overweight, if you are overweight, if you are big, you are at risk for developing hypertension. Those that are not physically fit, if you are not exercising, you are at risk for developing high blood pressure. High salt diet, you are at risk for developing high blood pressure. And I will talk a little bit about the high salt diet. Wherever wherever water is, salt follows. It's like they intertwine. So when you have a lot of water in your body, salt will be there. If you have a lot of salt in your body, water will be there. Fluids will be there. Now, when that fluid is there, when you have a lot of fluid overload, when you have too much fluid in your system, your heart has to pump that fluid. The kidneys also become affected. And that's when your blood pressure is high. So those that eat a lot of salt, they are at risk for developing high blood pressure. Also, those that drink a lot of alcohol, they are at risk for developing hypertension. Um, I will talk about the risk factors. I talk about salt consumption. When you eat too much salt, that's a problem. Exercising is very good. People that smoke, they are at risk as well. How do you know you have hypertension? What are the symptoms? How do you know what would make you say, you know what, let me go and talk to my doctor? What would make you want to visit the doctor or be concerned? Chest pain. If you start to develop chest pain, sometimes it radiates. The radiation, when it starts to go down the left hand, that's kind of dangerous to call your doctor or call 911, get yourself in the hospital. For some patients that have that, we give them nitroglycerin. When they start to develop chest pain, because that kind of calms it down. And after you give it to them, they have to go check themselves. They have to see a provider whatsoever. So chest pain is number one symptom. Number two, severe headache. If you see that you took Tylenol and it's not helping you, you took something to stop your headache, but it's not stopping. Severe headache, where you cannot concentrate, where it feels like somebody is pounding your head with a hammer. That's a symptom of hypertension. When you get dizzy, dizzy means like you feel like you're about to faint. You feel like you are about to pass out. If you feel like you're about to pass out, that's a symptom of hypertension. Vomiting. Out of a sudden, you just feel like throwing up. You get nauseous, being nauseous. Out of nowhere, you just nauseous and you want to throw up. Some people get nauseous. Some people start to actually vomit. When you notice that you are vomiting, that's a problem. Breathing becomes very difficult to breathe. You are not breathing normally, like you are out of breath or you have shortness of breath. That is a concern. That is a symptom of high blood pressure. um Sudden vision change. And when I say sudden vision change, is you somebody that could see, and all of a sudden the place just got dim, or it just got dark, or all of a sudden you start to see people three instead of them being one. You see one person like blurred vision, like you cannot see them clearly. Your vision has changed. That is a symptom of high blood pressure. If you out of a sudden become so confused, like you are so confused, like your thoughts are not together, like you just suddenly just got confused, that is a symptom of high blood pressure. Anxiety, like you just, like when I started to talk, I said some people have it from stress. Maybe somebody was, maybe you got a bad news, you know, and out of a sudden you're anxious. You um you don't know how to control it because the body is reacting to whatever you have heard. Anxiety, that is another symptom. Some people hear sounds like a buzzing sound, like in the ears, like your ear, like a beating sound in your ears. It's because you could hear, if you pay attention, it's actually your pulse beating. I had that when I was pregnant. I had it with my son and with my daughter, because with my daughter I had preeclampsia, a condition that affects women. Some women, when they're pregnant, when their blood pressure is high, it affects them. So that happened to me when I was pregnant with my daughter and my son. Some people bleed from their nose. The pressure is so high that they start to bleed. Some people, their heart rate rhythm is not normal, it's abnormal. So those are the symptoms of hypertension. In order for you to know that you have it, you cannot find out by yourself. You have to go to seek medical attention or medical advice from a doctor, a healthcare provider. They have to check your blood pressure. Sometimes they'll do a routine checkup. Sometimes just going at the moment They will know at that point, checking your labs and things like that. How do we treat hypertension? Losing weight is very important. Being physically active is very important. If you can smoke, I would say stop smoking. Those that like to drink alcohol, I would say, for me, I would say don't drink. But for those that feel like they must drink, drink at a bare minimum, just a little bit, just for the taste. If you want to have that taste, start to have a healthy diet, low salt diet. We call it low sodium diet. A pinch of salt or no salt at all. It's very important. That is treating it on your own, trying to take charge of what it is. But we also treat it with medications. The doctor may prescribe some medications for you that will help lower your blood pressure. We have metoprolol, losartan, potassium, propranolol. We have different types of atenolol. We have different types of high blood pressure medications that the doctors will prescribe for you. And for some patients, it's advisable to check your blood pressure before you take those medications. And the goal is for our blood pressure to be below 130 over 80. You know, when it's below, it is good, but when it's high, you are at risk for chronic kidney disease. You are at risk for cardiovascular disease. You are at risk for stroke, for diabetes. You are at risk for a lot of those things when you do not um, treat your blood pressure. For those people that have the blood pressure that's ranging from 130, because the normal range is from 120 over 80, but when it's above 130, your risk is developing um stroke. Your kidneys may fail, your kidneys might shut down, you know. So you want to take charge of your health. You want to take charge of your condition. When our blood pressure is so high, it affects our kidneys. There are some people right now that are on dialysis because their kidneys shut down because their blood pressure could not be controlled. The blood pressure could not come down. So the kidneys shut down. And when your kidneys shut down, it is very dangerous because the kidneys filter. The kidney is used for a lot of things. So if that filtering machine is not working, that is a disaster to your body. And it is a problem. So for people that have high blood pressure, like the ones that are in the maybe 140, 140, 145, like above those numbers, um, the doctor will try to prescribe you some blood pressure meds, lisinopril, enalapril, to relax your blood vessels and also to prevent your kidneys from shutting down. Because when your kidneys become damaged, that's it. You now have to go on dialysis or die. Because if those toxins are not excreted out of your body when they build up, that's a problem. So the doctor will prescribe, lisinopril or enalapril to relax your blood vessels. It'll prevent your kidneys from being damaged. And then the doctor will also prescribe losartan. Like I said, it's another high blood pressure medication that helps prevent that and also relax the blood vessels. Amlodipine as well. It relaxes the blood vessels. And sometimes the doctor will prescribe diuretics. What diuretics do, remember I said from the beginning that when we have a lot of those that have high blood pressure, some of them suffer from um, fluids, like they because of salt. And I said wherever salt is, wherever water is, salt follows. So when there's an increase in salts in your system, there is an increase in fluid in your system. So what the providers will do, Lasix, they'll prescribe you furosemide. It is a pill, it's a diuretic pill that's um like a pea pill. It gets a lot of fluid out of our bodies, you know. Um we have different types of diuretics. Furosemide is not the only one. We have torsemide, we have hydrochlorothiazide, we have chlorothalidone, we have let me see if I can remember another one. We have different types of diuretics. So the purpose of these diuretics is to remove excess fluid from your body. When you have excess fluid removed out of your body, that lowers the blood pressure. When you have a lot of fluid in your body, your blood pressure goes up. And these are the complications. When your blood pressure goes up, you are at risk for developing stroke and kidney failure and things like that. So how do we prevent this from happening? How do we prevent us from getting high blood pressure? How do we prevent it? Exercise. Be very active. When we move around, that makes our heart starts to pump. When we move around our body, the heart, the blood starts to flow throughout your body. When we eat a lot of fruits and vegetables, those help a lot. When we are not overweight, that's a good thing when you are not overweight. Taking your medications that your doctor prescribed for you. I advise people at every age now, like adults, not kids, adults, to take 81 milligrams of aspirin. The baby aspirin, we call it a baby aspirin. It's very, very important for us to take. It's very important in preventing stroke. It's very, very important. 81 milligrams aspirin is very important to take. Preventing hypertension, those were the things we should do, the good things. Things that we shouldn't do in order to prevent: stop smoking, stop drinking. If you have to drink, don't drink too much, just drink a little bit. Do not eat food that are high in fat, like African people. Like when I went to Liberia, a lot of people I checked their blood pressure went very high. Um, we have we eat a lot of food that are high in fat, trans fat, saturated fat. We like salt. We like seasoning. It's okay to season your food, but be careful with the salt portion. When you are seasoning your food, I prefer people seasoning their food without salt, because the seasonings that they have now, they have salt in those seasonings. So I would suggest that you only use your seasonings and avoid salt, because those seasonings are made with salt. So imagine adding those and then adding salt. That's a lot of salt. Whenever you add, when you start to um prevent this, or you try to eat healthy, or you try to change your lifestyle, and you try to lower your high blood pressure, you are preventing stroke. You are preventing your kidneys from failing. You are preventing yourself from getting heart attack. You are preventing yourself from other health problems. So it is very important that we reduce our risks. It is very important that we manage certain things that we do. Like I said in the beginning, stress can cause high blood pressure. Manage your stress. Some relationship cause stress. Some employment cause stress. One thing I tell people at the job site is that calm down, you know, because if you are working on that tension, we work on the tension, but if you are working on the tension and you are so stressed and you are not allowing yourself to calm down and you are not giving yourself a break. Like I tell my coworkers sometimes when it's stressful, take a break, take a 15. That will make you calm down, rethink, compose yourself, relax your mind, just bring away from some things will relax you. And that will minimize the stress level. That will also reduce your stress level. Because when you are so stressed, and God forbid something happens to you on your job and you fall and they have to take you to the hospital, they are gonna find somebody else to replace you. It's just as simple as that. You will be sick in a hospital, but there is somebody else working your shift. So take care of yourself. When you feel so tense at work and you have a headache, ask for a 15 minutes break, take a break, or 30 minutes, or take a break and then come back and deal with whatever it is. Um, we should always check our blood pressure. If you know that you suffer from a lot of headaches or your sight suddenly becomes blurry or sometimes you're just so nauseous, get you a portable hypertension, a portable blood pressure machine. Some of them are very cheap. Get you one to check yourself. It's good to check yourself when you wake up in the morning. Check your blood pressure. Because when you wake up in the morning, your blood pressure should not be high. Because you just came from resting, you just came from sleeping. You had a good morning, you had a rest, you rested for maybe 8 hours. So you should be calm. There shouldn't be any concerns. But if you wake up and it's so high, there is a problem. Um, Being exposed to polluted air is also a risk factor for us developing hypertension. We should be careful of our surroundings where we go, the areas we go, and that's that. I talked about complications, right? No, I didn't talk about complications. All right, so I'm going to talk about the complications of high blood pressure. I talk about the symptoms, like some people have chest pain, and chest pain also is a complication of high blood pressure because when you start to feel chest pain, there is constriction, like constriction, like tightness in the chest, like there is a problem. Some people when they're having chest pain, some of them will be like, oh, my chest hurts. Some of them they try like they want to like grab their chest, but you can't grab it. But that's like the effects in the left hand. Then they start to feel the pain go down their left hand. Some people have heart attack, and the reason why there is a heart attack is because the heart is blocked. When there is so much pumping of the blood, I talk about pumping of the blood. When there is so much pumping, the body, when it's like you're bleeding. When you start to bleed, if you watch yourself, if you cut yourself, God made us in a way that when we cut ourselves, um, the body starts to develop clots, and that clot is to stop the bleeding. So automatically the body, the brain registers that, oh, there is a bleeding and we have to stop this bleeding. So the body starts to produce clots to stop you from bleeding. Now, in this case, a person that has high blood pressure, your body does not know that you are not bleeding because the blood is flowing. So the body does not know. And when the body does not know that, blood clot forms. And when a blood clot forms, there is a blockage. The blockage prevents blood from it prevents the blood from flowing. the muscles of the heart start to die because they are not receiving oxygen. Our blood carries oxygen to the heart. So when the muscles, when it's like somebody that is brain dead. They are not receiving oxygen to their brain. Although their body is functioning, their heart is functioning, their brain is not functioning because a clot just prevented them from receiving oxygen to the brain. So it's the same thing as a heart attack. When they say that, oh, I'm feeling chest pain. Oh, my chest. It's like my chest is they feel constriction, like there's a tightness in their chest. It is because they are not receiving that blood flow, the blood flow of oxygen. They are not receiving the blood to their heart. And then the muscles, the cells, the muscles in us, the cell muscles begin to die because there is no oxygen. And then when this happens, the heart becomes damaged. When your heart becomes damaged, some people get stroke, heart attacks, some people die. Some people heart fails. They have to pump it back up, do CPR, resuscitate the person. Sometimes they have to do a surgery to see what's going on. When the heart fails, when your heart fails, your heart cannot pump enough blood and oxygen towards the body. And when the heart cannot pump, the heart is our major organ to pump blood throughout our body, our kidneys, and everywhere else. When your major organ is not pumping blood towards the other parts of your body, there is a problem. Your cells in those areas will break down, they will die. And then when this happens, when the heart is not pumping blood or it's not pumping, we start to get irregular heartbeat. Cardiac arrest occurs when your heart is not pumping. All of a sudden, the heart just stops. Boom. And that's it. That's how people die. Also, some people fall off from um, clots, blood clots in their brains because of the blockage. Aneurysm. Some people die from brain aneurysm. There is a blood clot that travels and then it gets in their brain. It enters the blood vessel and it expands. When it expands, there's a pop, it bursts. When it bursts, you start to bleed in your head. And that's how some people become brain dead. Because when you start to bleed in your head, you are not receiving oxygen to your brain. The artery is blocked, and the blood that's supposed to go there to give you oxygen in your head is not flowing, causing stroke. Some people, their left side is affected because of what happened on the right side of their brain. You know, so take care of yourself. I will be coming on every Monday to just discuss our health, talk about our health, talk about the importance of being healthy, talk about the importance of removing yourself from situations that will cause problems, um, situations that will cause problem in the body. I'll be talking about some conditions, some things that people experience back home. The different types of nursing. I am a nurse. So I've seen nursing both places. I've seen nursing in the United States and I've seen nursing in Liberia. So I will talk about my experience as well with the different atmosphere, different locations every Monday. And also, if you have any questions, you could ask me questions. If you have any concerns, you could ask me. And if I know, I will answer off my head. If I don't know, I will ask my provider or I will do some research. Share this broadcast, help somebody to remain healthy, help somebody to put their health first, help somebody to stay alive because that's very important. And if you know anybody that has hypertension, share this with them. This will help them. This will even help people that don't know that they have high blood pressure. So today we talked about hypertension, what it is, high blood pressure, what it is, who's at risk. This video will tell you who is at risk for high blood pressure. What are the symptoms when you have high blood pressure? How do you treat high blood pressure? What are the complications and how do we prevent high blood pressure? God bless you all, and I will see you next week, Monday. Have a wonderful night and stay